I think we can get, you know what? We're going to get started. Oh, there's my whole gallery. We're going to get started because I did promise a little transitional wellness activity. So got to stick to time here. So welcome back, everyone. And as I said, as I promised, as we signed off to be, we're going to start this session with a little short wellness activity. And it is on the theme of context. So on things that ground us. And Mother Earth is an especially profound source of grounding. So this short little activity is to help us connect with her. So whatever position you find yourselves in, I invite you to lift one foot off the ground at a time. So if you're sitting, you could do little gentle foot raises in your chair, on your stability ball. If you're standing, you could march on the spot. You could do some high knees with, that has a little bit more invigoration as everything falls off my desk. And for the really energetic, have you ever done this one? You can't even see what I'm doing. Fast feet, each foot off the floor, You can do it. Whichever mode you're in, keep going, away we go. We'll just do this for less than a minute, but keep it going. Wiggle too, if you like. I know that was, needs to be back by popular demand. Little bit of wiggling, upper body, lower body. Keep those feet moving, up and down, right then left, up and down, fast or slow, doesn't matter, just a little bit of moving, but lifting those feet one by one off the ground. Awesome. And as we stop, no matter what position you're in, feeling the earth under your feet, really take a moment, close those eyes, feel the contact, your feet on the ground, feel the stability, and thank Mother Earth for her support and grounding. And thank you for joining in that little wellness activity break. So now we're moving into session 2C, and I never like to prescribe fun, but I can almost guarantee this one's going to be fun. So it's going to be a real jam board, that is. I remember yesterday in the opening remarks, Stephanie Priest, she mentioned the jam board. So this is where we get to use that little software. So this session is about your context for child and youth mental health promotion. We've come from international to Canadian, and now we're moving into inviting each of us to really consider our own context and a chance to explore what some relevant features might be about your context and how you experience it. So essentially exploring the question, this is the question that will hold with us in our discussion groups as we move into them. What are some features of your context that may benefit from your awareness and your attention to optimize your activities and impact? So features of your own context. And we've got a little exercise to explore that. It's not a full discussion base. So we'll do this in small groups. And again, there'll be about 10 people. And as noted in the Hub's end of day one email, we'll be inviting each of you to choose a topic area, choose a room of most interest to you to join. And they're mostly different population groups, but a little bit different. I do want to reinforce that your choice doesn't have to be a perfect fit for you. They're really just loose clusters as we put in our note, and it's just to get some sort of light sorting with people who might share similar interests. So you'll still be able to talk about your context, however you experience that. So we've just got a very small number, I think it's 3 or 4, but a few little introductory slides that are going to help us set the stage for this session. So these are the different room options that are going to be available. So after a brief description of the group exercise, Eric will give instructions for joining a group. With each group, if we go to the next slide, there will be I've got to move this on my screen. Okay. There will be a facilitator And that person is to support the group process, and a resource person. And that is someone who has expertise in the area of interest, in the topic area, and will be an active participant in the exercise. So the group exercise will ask you to think about your own context. And we're going to do this by using a very common systems model. We're going to use the iceberg model. And the goal is to really bring your attention to important elements of your context, some of which are visible and above the waterline, which is the classic characteristic of the iceberg model, and others that are more hidden and invisible or below the waterline. And I'm going to invite Dr. Laura Struick, who is a Hub Resource Collaborative member and an assistant professor at UBC Okanagan. And I will add a previous postdoc with me, love her to bits, who did some terrific work on a workshop series about systems thinking and public health. And Laura is going to describe use of the iceberg model, and I think a little bit of a tag team that Eric may also describe afterwards, or show how to actually use it. So Laura, over to you, please.
Thank you, Barb, and hi everyone. Thank you for this opportunity to be here today and be a part of this exciting session. So as Barb had mentioned, the iceberg model is a very common systems model, and the most important feature is that there are system elements that are above the waterline, the tip of the iceberg, and then system elements that are below the waterline. And so above the waterline relates to what we can see. It's the interventions, the services, the research data that we have available to us. And then we have below the waterline, and that's what we can't see, but influences what happens above the waterline. So it's the social norms, it's the policies, the deeply held beliefs that surround an issue like child and youth mental health promotion. And so the idea of this model is to demonstrate how the invisible impacts what is visible. So in other words, the invisible elements, what's below the waterline, has a lot of leverage, if not the most leverage, for maintaining the status quo or for generating change in relation to an issue. And so being aware of what is happening at these various levels will bring our attention to the most promising leverage points for pushing mental health promotion forward. And so by populating each level of the iceberg, first during our exercises, first through individual reflection and then through group discussion, you'll be able to come back and share a story with the whole group about what is going on from your perspective in your topic area with regards to that iceberg model. And so then in the closing discussion, we're going to reflect on where people are focusing their efforts and attention currently. Are they above the waterline where it's more reactive, or below the waterline where it's more proactive? And which layers have the most potential for creating change? So I'm very excited about this. Barb, I'll hand it back over to you.
Oh, that's perfect. Thanks so much, Laura. Really nicely done. And, you know, although the model that's that iceberg model that's sitting beside us right now looks very static, now Eric is going to demonstrate use of the actual Jamboard software. It's super easy. Trust me, even I caught on. So, so Eric will actually hopefully be able to pull that up. Poor Eric. and show us just how to, there's one little function that we'll be using, and that's the function of the sticky note. So Eric, over to you.
Great, thanks, Barb. So what will happen is once you join a breakout room of your choice, you will see this link to this page, this Jamboard, in the chat. The facilitator will post it in there for you. And you will arrive on this page in your browser with a few functionalities, but the main functionality, the primary, and really the only one to use for this exercise is the sticky note here. If you can see my cursor on the left-hand side, it is the fourth button on the left here in this menu. As soon as you click that sticky note, a little window will pop up where you can type your idea, something that's visible. And you enter in what you want. You can choose different colors if you wish. And once you have posted your sticky, you are free to move it around and place it where you think it belongs. And you know, with this workspace, feel free to use as much of it as you want. You don't necessarily have to paste the sticky onto the iceberg if they're starting to run out of room. You can also keep stickies off to the side if you want to think about where it might end up, or or best be represented as you work through the exercise. And that is really it. Each room, you'll see this is an example of the early years room, which is the first. Each room will have its name posted in the top left here and a little prompt for the exercise below the iceberg. And I believe that's all there is to it. I'll pass it back over to Barb.
Yeah, that's fantastic. That's great. So you all know what you're going to expect in the small groups now. So as Laura mentioned as well, after the small group, we will actually return to plenary. And this time we won't just do a short close. What we will do is we'll actually give just a couple of minutes for so that everybody can see the other maps that have been created. These aren't, these are going to be messy. They're not masterpieces at this stage. It really is about being able to put out there what you see in your different contexts. And so we'll just share those. And then these two will be shareable products from the symposium. And we will be inviting each resource person from each room just to give, like a one or maybe one little nugget about the group discussion or about what people see on the map. So that's when we get back to plenary. For now, we're going to move into the breakout rooms. Now, these, as I mentioned before, these are not randomly assigned. And this was in the note from last night as well. It's just to think about which group you may want to choose. And so once again, I'm going to pass the baton over to Eric to give the instructions on how to choose your room and get into those.
For sure. So we will show that list again of the 8 rooms, but what I will do is I will open up the 8 breakout rooms, and what will happen is the facilitators and the resource people will be moved automatically to those rooms. You as the participants can find the breakout rooms in the Zoom controls below, and you'll see a list of each one with the option to join whichever one. Each room is titled based on the topic area that will be for that room. So early years, for example, in the image that I showed earlier. It's up to you to join a breakout room. And if you have any issues with actually finding the breakout rooms or joining one, you can let me know. I can also manually assign you to the room. So I'll open up those rooms right now, and we'll let you take a peek at that. And I just also wanted to add in that when adding stickies to the iceberg model, please feel free to enter in either in whichever language you're comfortable with, either English or French. Donc pour ceux qui veulent entrer des éléments en français, vous pouvez le faire tout de même. Donc merci. And I will open up the breakout rooms now.
Darn, we cut off Brenda Rastool.
Oh no.
Eric, could we give her just a second to finish her thought when we come back, please?
Absolutely, yeah.
Okay.
That's okay. I was really ending the thought, but
yeah, but it was really important, Brenda. So, yeah.
Yeah.
That's the worst possible moment. The worst possible person to cut off.
Not at all.
Into this session.
Yeah,
Sorry
so
for that, Brenda.
That's I saw it was ending and I was trying to talk fast. I swear I was. No, and just for those in my group, what I just wanted to end with is that when as First Nations, we have some good synergies with the federal government. If that is not, it doesn't always mean that it translates to what happens in our communities if the provincial government isn't in agreement. And so I think a big challenge is, and I did put it up as a tipping point, was how do we get the provincial and federal governments to be on the same page around understanding around Indigenous mental wellness or mental health promotion, even more broadly. Thanks.
Got it up on a sticky a little bit.
I noticed that the Jam boards were still open. Barb or Eric, do we have any timeline of when they will close in case anyone has any last thoughts they wanted to add to their Jam boards?
That's a great question. We will, at the end of the session, we'll definitely save a copy of it. Once we close up the session, that'll probably be about the cutoff of when adding or shifting things around will be.
Perfect.
Okay.
So over to you, Barb, I think, right?
Yes, okay. Yes, I am unmuted. Okay, so wow. It was fun. I hope every group, I mean, just, you know, kind of got into that mindset of the above the line, below the line, etc. So as promised, we're going to have we are going to have sort of a sharing and not a fulsome commentary, but just, you know, think about it, the resource people, basically, you know, a point or two that helps the rest of us kind of get our heads into what was most, you know, what was something that was maybe most central in your conversation or what your map shows. So we'll have about 3 minutes for each map. I think we're still on track for that. And we'll invite the resource person from each. So, and I guess Eric, if you're able to show, then we'll start, and we'll just go through rooms 1 to 8, so nobody is surprised about the order. So starting here with, we've got Chaya, please, for early years.
Yes, hi everybody. So there was no shortage of conversation in our group, and in terms of some of the themes that people noted, a big one I think was lack of data, because people saw that as a real problem in convincing, in just getting people's attention, policymakers, you know, political parties, everybody. It was just a huge barrier. And then also just people's understanding around what is early mental health and debunking the myths that are out there that kind of get you know, perpetuated over and over and over again. So you have policies that are actually founded on some of these myths and systems that are actually designed based on these myths, and how do you begin to change those? And, you know, an example would be in the province where I am, we have children's mental health treatment centers, but most of them typically practice from the age of 5 up. So right there is an entire system that just hasn't, as a system, actually acknowledged what's going on for younger groups. Also just a real lack of training, and that was across sectors, that whether we were talking about early childhood educators or physicians, a lack of training and a lack of resources that was hugely problematic. So sometimes you had people trying to retrofit something created for older kids into something for younger kids, and it doesn't really work very well when we do that kind of thing. Possibly an opportunity, given the pandemic, to draw some attention to this area. Although I was sharing with the group, I didn't feel that way this morning when I was having a hard time convincing our public affairs people that a COVID survey of 2,000 families from across the country was newsworthy. So I think there is an opportunity, but I still think it's going to be a bit of an upward climb. And then the fact that the stage is just so crowded in this area, and the focus tends to go to where the fire is. So, you know, with youth, there's a real need for sure. And many of us said, you know, it can never be a conversation of either or within the sector, because all age groups are really, really important. And that then, you know, raised the issue of just there's not enough funding for this age group. And, you know, it's really refreshing to see that PHAC has recognized this, and certainly the Ontario office has been really supportive, but there just is not enough funding for this. I think those were sort of the main themes. I'm just revisiting our board.
If it's okay, can I come in?
Yeah, please do, please.
I just think that it's really interesting to note some of the tensions between what we can see and what we can't see. And in particular, is that we need policymakers and decision makers to have data in order to get buy-in from them, essentially. But in order to generate this data, we need funding and resources, which is what we're lacking. So there's kind of this tension in terms of a data need, and then also a lack of resources to actually produce this data. And Claire actually brought up a really important point in that we do have some very valuable data at an international level, and that perhaps there's benefit in considering having international conversations about this in order to accelerate moving mental health promotion forward for the early years.
Awesome. Fantastic. What a great bit of a tough act to follow, actually, Chaya and group. So congratulations to all of you. And obviously it was a really rich discussion, and thank you, Laura, for those observations. So let's keep going so that we don't, so that we make sure we do get through actually all 8 of the rooms. So Alexandra, if I can invite you to give a little bit of commentary here on the school-based setting.
Yeah, so we had a really great conversation. Where we started was recognizing that across the country, it's not the same. So for example, an example that bubbled up is in Quebec. Yes, students are back in school, even though they're in lockdown. And the political agenda is, the focus is on academic and not on mental health and well-being. Whereas in Ontario, there is definitely a political support related to upstream interventions for school mental health, and also mental health supports offered through schools. And our country, we don't have the same, like provincially, we have important nuances. Oh, do you hear me? My
You're back now, Alexandra.
So yeah, I apologize for that. There's a winter storm going on, and I apologize for my internet connection. So basically throughout Canada, each province has a different priority and a different lens and political agenda related to mental health within schools, and the types of support and fundings that are made available. What we also noticed, if we go from the mental models up to what we see, so what we don't see are assumptions, beliefs, values, biases, and attitudes related to mental health, and its place within schools. Having that very important youth voice again is essential, but isn't consistent. There was a very positive tone that amid the pandemic, our students are demonstrating, many students are demonstrating a lot of resilience in spite of that loss of routine and that loss of school connectedness, which is a huge important factor as a determinant of health, as was discussed. But students are finding their own strengths, which is great. What we're also noticing in this pandemic is there's a huge shift towards, obviously for students who are not in school, to that virtual learning platform. The high expectations that the education level, the expectations from funders, from families, and so on, that the education level be at the same level that it would be in person, is not really realistic. There's an increase in teacher stress. There's the reality that teachers have living situations that might be difficult and extenuated in the pandemic, and reminding ourselves to be compassionate that we are in really difficult times right now, and that the learning might look differently during this current context, and that we're all doing the best that we can with what we have. Which again looks differently across the country with the lack of resources, training, and so on. But in other provinces where that has been a priority, those resources have definitely been provided. But even if they're provided, how do they get to the people who actually need it so that it's translated to our students is variable. So it goes back to Dr. Berry's point about the importance of thoughtful implementation. And things that we do notice and that are really strong in the school sector is really those key relationships, collaboration, partnerships. School systems know that they can't go about this alone. So those really important system level partnership, political level partnership, but even school level partnerships with their community is key. So that's a really broad brush summary. I hope that was sufficient. Team, did I miss anything? Oh, that's
great.
The gap about equity. So
Okay.
because we're in a virtual learning, there's definitely a gap related to that.
Okay, awesome. Awesome. Thank you, Alexandra. That's great. This really, these are brief report backs, and we, it's the richness. There's no way any of us can absorb all of this in the, just sort of a little highlight from each map. And we will be sharing these with you and be able to provide some commentary that will draw in some of the richness that Alexandra was able to share there. So let's move on to room number 3 and youth and young adults. Over to Sarah.
Oh, okay, great. I turned off my camera because I was eating a cookie like ferociously, but I think I've cleared any crumbs off my face, hopefully. But okay, so I'll just cover a few points. I'll take that note, Barb. With some of the things that we covered were around, so we have these concepts at the bottom about, this is my sticky, which is embarrassing to bring up, but it was that youth believes that problems aren't bad enough. So I had written down, someone else in the group had said, it's not bad enough to see a psychiatrist, but I don't know where to go. And we had talked a little bit maybe about that missing middle, or about like an all or nothing thinking, like, I don't want to take someone else's spot. We talked a lot about, like, we're hearing about wait lists, but like, I don't know where to go for help, or not recognizing signs and symptoms, tying to stigma or expectations or some of those other stickies or beliefs. So this general, not bad enough. I don't look like what I've seen mental illness represented as, but I don't know where to go. Not necessarily having the language around how to talk about what you're feeling and understanding if it's a struggle or if it's normal or if that matters or anything in between. So that was one of our big themes there. And then another theme we had was about interconnected systems or programs. And we talked a lot about youth programming being disjointed, or schools or services or different programs, and like the lack of resources that we sometimes have if we're just, independent services, but also integrating with other systems and general streamlining and sort of duplicating or cooperation or collaboration and all of those sort of different concepts there. We talked about so much more than that, but I'll let someone else step in if they have something to add, or maybe I can keep it with those 2 high-level points for the interest of time.
Brilliant. Well done. Oh, the richness is just, it's just that these are real teasers. Thank you. That's fantastic. And you know what? As you're listening, as everybody's listening to these, please don't hesitate to, in chat, if there's anything you want to add to what you see there, feel free, or just, questions of clarification, whatever. Don't hesitate to use chat as well. All right, we'll move on to map number 4, and we'll invite Mariette.
Great. Hi, everybody. So we have lots of stickers. Of course, a lot of them are, on top that are visible. And I've noticed that's a commonality with the other maps. So, but I think what we said was it's just important to be aware of what else is out there, to get to know our context and know, to be able to connect with other services, and to keep that holistic piece in mind. Somebody was talking about, you're in a program where you're trying to support socio-emotional support, but the family can't pay their rent. So knowing what's out there is, in your context is really important to be able to help the whole family, for all their needs. We talked a little bit about, this is close to my heart, this idea of making sure that we stay connected with policymakers and anyone who can help us move our agenda, that it's important to invest that time. So to understand that invisible, what's underneath, to understand the systems and structures where we operate, and that often really helps for sustainability. But and sometimes we forget to do that because we want to do. I know I do anyway. But we were just talking how that's an important thing, and generally to pay attention to that what's invisible. And I think it's I think that's all that, I mean, we talked about a lot of stuff and we have lots of stickers up there, but maybe unless someone wants to add something from my group that is burning, I'll pass it on.
Terrific. It's actually, and that would, thank you so much, Mariette. I mean, and that was on the caregivers, parents, and families, and even recognizing the sort of systems of care and the multi-level influences that there are on children and youth mental health. Now over to room 5, map 5, and Brenda on the Indigenous topic.
Yeah, so we had a really interesting discussion about a lot of some of the challenges we have. So it looks like there's more challenges than opportunities, but I think we talked about some of the difficulties that come with a whole different perspective on how we look at mental health promotion. So whether that's things like lack of recognition in our systems for Indigenous pathways to well-being, how funding is disproportionate between fly-in and fly-out community counselors, so those with mainstream training versus those who hold Indigenous knowledge. Also, the different types of programs. So land-based programs don't get funded at the same way that sort of mental health counseling and other ways are funded. Devaluing of Indigenous culture. We talked about some of the things that come with supporting Indigenous communities, like criminalization of Indigenous land defenders, the overrepresentation of children in the child welfare system, residential schools, all those kinds of things, colonial systems and its structures, that they all play a part. And we also talked about how there's not a lot of data to support the Indigenous evidence, and it really requires a lot of investment in that space, and that there are not enough of us, I don't think, and I'm maybe saying more than what was articulated in our group, but there's not enough Indigenous researchers and scholars to be able to get the work out. There's a lot to do. You know, I think in a lot of ways, the evidence in mainstream is very big and piled really high. And, you know, we're just starting to build our mountain. We know our own mountain, but not the same. We don't have that same mountain to point to governments and funders. And so those are some of the challenges that we experience. But we also talked about things that are helping to shift that, and some of our reconnection to ceremony and language and land-based programming and recognition about the Indigenous social determinants of health and needing to invest in those, that there is this is both an opportunity and a challenge depending on where we go across the country. The ability for federal, provincial, and Indigenous government collaboration. So when that's happening, we see some real growth and some opportunities. But when it's not happening, there's a real challenge. And so our communities that are federally funded are always struggling to ensure that they're able to translate that information to the federal government and then to the provincial government and have everybody on side. So, you know, it's double the work in some ways to do that kind of thing. So it's both an opportunity and a challenge or a barrier. That there are now some tools and resources that are accessible to our communities. They're recognized. Those support our ability to continue to do our work well. And recognition about our knowledge as evidence is really starting to change it. I think we have in one place in the wrong. We were trying to move it around because we were trying to do this because we talked so much. The First Nations Mental Wellness Continuum Framework as one of those opportunities that allows for translation of information. And so we were talking about how it's important to be able to utilize our evidence and have it put in ways that our communities can then translate that to funders and translate that to government, so there can be investment in what we know works, those programs that work. And so Gwen talked really well about knowing what works and trying to ensure that government recognize that they work. And that's about translation, I think, in that as well. Yeah, I'm not sure if I missed anything, but I'll stop there if anybody from my group wants to add anything.
That's great. That's great. I mean, there's a story behind every single sticky, and then the collection of stickies themselves, even what was done in that short time. Thank you. Thank you, Brenda. We will move on to, we've got 3 more groups just to hear brief highlights from. This one is, I'll invite Claire Crooks, and it's the newcomers, immigrants, and refugees.
Thanks, Barb. We had a small but mighty group, and we did begin to group them a bit. So the orange ones are the kind of the main theme of the grouping. So I'm not gonna, that's all there. There's 3 observations I would make. One, we had a great discussion about a lot of things being at the waterline. So some things like racism or sociopolitical context or language barriers, and that it's somewhat visible, but we probably don't know the extent and the experience of different people. So that needing to be aware that there's hidden pieces. Um, on the negative side, we talked about the disproportionate impact of the pandemic, particularly for refugee families, and we talked about it in different ways. That one, in terms of what types of jobs they're more likely to be working in terms of being essential workers or maybe frontline healthcare workers, not having the type of benefits to be able to stay home easily, but also in terms of the importance of routine, and for people who've had a lot of upheaval and had really well-honed routines, that's all been thrown up in the air. And then finally, that the pandemic is really triggering for anyone who's had experiences of trauma, but there might be some specific pieces around having your mobility restricted, or lining up for food, or some of those things that may really be very challenging for people who have had similar experiences in their migration journey. But balancing up the negative side, we all really were on the same page talking about this move towards strengths-based policy and programming, and that we still want to include a trauma-informed lens, but going beyond that to a focus on resilience and strength, and honoring all the strengths of the youth and families we're working with. I'm going to stop there. It's all written down.
No, that's fantastic. Wow. Oh, it's a lot to absorb, and as I say, we don't need to do that all in the moment. So let's hear from room number 7. This is Trish Van Katwick as the resource person, and on the overall field of child and youth mental health promotion.
Thank you. Our chart looks so tidy. Maybe we should have messed it up a little bit before coming back to the large room. So yeah, this was a really interesting conversation, and we kind of had a moment at the end to sort of think about what some of the main takeaways were. One of the pieces that we looked at was kind of some of the tension, sort of looking under the surface, some of the tensions of some perspectives and ways of thinking about and understanding that could create obstacles to really strong mental health promotion practice and research. But alongside that were these perspectives and ways of understanding that were actually clearing a really nice path and enhancing the ways in which we could think about and practice mental health promotion. Some of what was discussed also was, looking again at evidence. What is happening when it comes to evidence, knowledge production, and some of what is happening in terms of the trends of our society are actually galvanizing some exciting evidence practices that can move us to a place of action. So looking specifically at social movements, there was some discussion around the pandemic and how some of those responses that are being developed because of the pandemic are actually revealing to us some new approaches that will help in the long run with our mental health promotion thinking and practice. And also sort of looking at the way that things are lining up. And so when we look at some of what's happening underneath the surface and how that is directing and guiding some of the actions and events that are happening above the surface, there was actually an expression of optimism or hope because of the way in which things are lining up. Some of the shifts, some of the changing, some of the things that we're paying new attention to, and how that can guide some pretty exciting and kind of socially just, I'll say, approaches to mental health promotion. Are there, I hope that I understood what people shared. Is there anyone in the group that wants to clarify anything that I've said or add to it?
It was a beautiful narrative, Trish. Thank you very much. And I can say that because I heard it all in the group. So very, very well done. Thank you for that. Okay, so we'll hear from the last room before wrapping up, and this is sort of the field in general as well, but with a particular focus on equity. And Claire, I invite you to share some highlights with us.
Yeah, thank you. Again, I just want to congratulate you, Barb, and your team. This tool, we did actually talk about the tool and that we enjoyed using it. And I'm going to say my observation is the conversation gained momentum over the time that we had. And I think we all appreciated having the time together to do this. I'm just going to, as I was waiting sort of for my turn and being the 8th group, I was reflecting on a definition of equity. And I think I'll frame what we talked about within that definition, even though we didn't use that in our conversation. So equity and inequities, but equity in particular is where you can see a difference, right? That it begins with a difference and being able to see a difference. That you know that there is something that you can actually do about it. We, you, us, the collective can do something about it. It's mitigatable. And we choose not to. And that's where it becomes an issue of fairness or justice. I think Trish just used the word social justice. So if we think about this map here, we found ourselves, my observation as I reflected back is moving up and down that iceberg, you know, down to somewhat what's invisible and then back up to the top. So like many have said, you can't see a difference without data and information, and you can't privilege, if you will, only quantitative data. So the qualitative, and you can see some of our comments there about developing the skill, if you will, to understand and unpack and as a policymaker, use qualitative data as well as quantitative data. And having that data be able to be disaggregated or nuanced by race, by age and gender and sexual orientation and other sort of social pieces, and becoming skilled at that, whether you're at that program, service delivery perspective, policy, or in society writ large. There was a lot, we didn't actually go a lot to programs. We tended to go up to policy, back to program, and then down sort of into what underpins in that. But we did talk about that we do know there is evidence, there is good business cases, you know, that show cost avoidance at least, if not cost savings. And how do you sell that cost avoidance kind of case? And then I think in terms of that, what is unfair or unjust and that equity perspective is, I heard a lot about voice and voices, and even as bold as suggesting perhaps, and maybe it's not bold, lowering the voting age to give youth an opportunity to vote and to actually have a legitimate say in our political system. But engaging with communities, engaging with youth, engaging with children and families, and really surfacing their perspectives. But then it's surfacing across, not just within that small group or within that small program, but getting it up at that capacity to be able to scale it. And it made me think about, and somebody did say that about all of our roles in what we might call movement making. Somebody talked about a social movement, but there's movements and tipping points. You talked about tipping points, Barb, and there's shifts. We use the word shifts a lot in our group and what's shifting. So to me, it sounded like movement building. So what are our collective roles in contributing to accentuating, you know, amplifying and pushing, contributing to some of that movement. And like everyone else has said, I think our group also agreed that the pandemic provides an opportunity. It really does, because it is making manifest for us and in the social conscience of our country and our world, the inequities that exist and the potential for addressing those gaps in a real way on the way forward. So we had a hopeful conversation as well. So I hope my group, I was respectful to the conversation, and thanks for the opportunity.
Oh, Claire, thanks so much. That's wonderful. Really. Thanks to all resource people and groups for obviously very active participation in that. I'm going to invite just any short point that Laura, as our fellow facilitator for this session, would like to make any sort of final observation before we close this session and move into short break in the next. So Laura, over to you.
Oh, thank you, Barb. And thanks again, everybody. I think I'll pull on from that hopeful note and just say that that's one thing that I noticed throughout the groups was there are some great opportunities and there are some whet appetites across sectors for moving mental health promotion forward. And so I think we are in a great position to help bring those voices of youth forward and have more of an inclusive conversation about how to move mental health promotion forward. So that's all I'll say, because I know we're getting late on time, but I like that hopeful note to end on.
Oh, thanks. Thank you, Laura. And, you know, I think particularly as we listen to some sort of highlights and points from each of the groups, that it's actually provided a beautiful segue to the closing session today on, not for the symposium, but today on the pandemic context. Just before we move there, I just maybe one sort of way to bring closure to the use of the iceberg model as well. I've always been struck by the notion that, you know, you find what you look for. And, you know, the iceberg maps, they really provide, I think, some good clues for what might be meaningful to look for in our context. And in this case, with the group gathering here, in the context of our efforts in child and youth mental health promotion. So you find what you look for. So let's, you know, focus our attention on all things above and below the line. I love some of the commentary around how the interdependence of those things as well. So to close, thanks so much to Laura, the group facilitators and the resources for contributing to the session. Of course, everybody who participated. Obviously, lots of rich conversation and stickies out there. We will share the maps and with some type of processing with them as well for some clarity and commentary on those. What we're doing now in the symposium is we're moving into a 30-minute break. You're all probably wondering, did we not get a bio break sometime? Well, you can always take that. But we are moving into a full-on 30-minute break now. And I do ask, or at least invite you, before doing so, you can head to the polls once again, just for a session-specific poll. Super quick, super easy. But in Whova, go to the agenda in the left navigation pane, find 2C, click on polls on the right-hand top panel, and you'll be there. So the next session, the 2D, it focuses on the pandemic context. We've really warmed ourselves up for that. We really can't separate these different contexts. An excellent panel awaits for that conversation. And so that will be in a half hour or on the half hour, 5 p.m. in Newfoundland. And if you've not already done so, and you have a moment, please do preview the handout that was posted on Whova and maybe posted in the chat here, the preliminary findings of the hub-led study on Mental Health Promotion Innovation Fund project pandemic adaptations. It's 3 pages, 3.5 pages to take a look at that. That was some of the homework for last night. So we'll close this session now. I invite you to wiggle for wellness a little bit during the break and do anything else for wellness during this 30-minute break. And we will see you back here after that time. Thanks so much again.